Welcome back. Sorry, Instagram gives me 1 hour and now we've got lots of questions, so hopefully people will join us again. So dandelion methylfolate, welcome back. We use probiotics and let's see, methylfolate, dandelion, probiotics, vitamin D3. The probiotics that we like are Femdophilus for right now. That's what we're using. You know, if you happen to be watching this in 2 or 3 years, I don't know what'll change. But Femdophilus seems to do a really good job of keeping group beta strep at less of a risk of that coming up positive, which is good. We use prenatal vitamins as a help, not as a substitute for good nutrition. The prenatal vitamins that we like are Innate Response, their Baby and Me product. I like any type of prenatal vitamins that are made from whole food, that smell like food, not smells like an overdose of B vitamins, even though B vitamins are good, that it doesn't smell like an overdose of it. And then at 28 weeks, we have them take alfalfa, between 2 and 4 capsules of alfalfa. That helps build vitamin K, which keeps the bleeding to a minimum. And then at 36 weeks, we use evening primrose oil, about 1,300 milligrams, because that helps to ripen the cervix. It helps a little bit with brain growth and development just because it's a fatty acid. And those are the supplements that we use. Morning sickness wise, a good cup of beans. Many times, many women do. I see you coming in on Instagram. Thank you so much for coming back. And I'm going to get to all of your questions. I'm just answering one that's right here about morning sickness to the point of hyperemesis. Some women have a really hard time with pregnancy hormones. And I would say going into pregnancy, start on some dandelion early, hoping to get that liver really wanting to be nourished well, and make sure you're real well hydrated. And the best thing that we've found is to use B6, 25 milligrams, up to 200 milligrams in 25 milligram doses throughout the day. That seems to help, but keeping yourself hydrated, which I know with hyperemesis is really hard, but the hydration has to be like you just don't go an hour without drinking a couple ounces, and you never go an hour without getting a nibble of food. And you just have to keep grazing, keep grazing, keep grazing, keep drinking, because once your blood sugar dives or once your fluid dives, it's like a spiral that goes way down, and then you have to have hydration, right? Some people have used Unisom with B6. If you choose to do that, make sure when you turn the package over that it says doxylamine, D-O-X-Y, doxylamine. Because Unisom, all the different ways that they package Unisom, they're not all the same drug. Some of them are the same as Benadryl, which is a more of an antihistamine. So make sure that it's one that says doxylamine on the back of it. And taking one of those with a B6 before going to bed, sometimes when you wake up in those early weeks, as long as you eat and drink also, helps. When you have partners, tell them just make small little quarters of sandwiches, a few of this, a few Cheerios, a few, nut butters or whatever, and just put them in brown paper bags and line them up either on the counter or in the fridge. Your job is to grab it, reach in it, eat it, don't think about it, put it away. Small little snacks frequently, and drinking, including at night. You put a small snack as 2 ounces of fluid, you eat, you drink, you climb back into bed. Each time you get up to go to the bathroom, 15 minutes before you get up, and that helps to reduce it. That being said, sometimes there are some women that really struggle regardless of what they do. And you might be one of them. Ginger is one that some people have used. Acupuncture seems to help with a lot of people. The C-bands, which is an acupressure, helps with some. Homeopathics, Byronia, Nux Vomica, Ipecac. But what I can say to you is I've never found a perfect recipe for everyone. but the nibbling and the drinking is a key. All of these others seem to be individual of how to correlate each piece together and what will work for them. All right, last, do midwives do home birth with type 1 diabetes? Most OBGYNs induce and do a cesarean at 38 weeks. Unfortunately, if you're on medication at all, whether that's oral or like if you're on metformin or you're on insulin, it's considered outside of our scope of practice to monitor you and to do a birth because of the irregularities that are there. So if it's gestational diabetes, it depends on how severe it is, because a lot can be done at home. I mean, I use a lot of supplements, as you can tell, and those supplementations and food and altering the diet seems to help in our practice to keep women, you know, these birth givers, able to stay on track. And yes, some of them have had larger babies. I mean, I've had 10, 11, and 12-pound babies at home. We have tons of 10-pound babies. We've only had about 3 11-pounders and 1 12-pounder. Some of them were gestational babies. The 12-pounder was not a gestational baby. It was just a big baby. And some of our 11-pounders have been that way too. So that would not necessarily be the best choice, but to have some midwifery care, to have a couple visits, to just call a midwife and say, I know I may be better suited in a hospital setting, but I'd like to have some midwifery care and get some knowledge and some wisdom of how to help make this the best situation for me. Okay. Thank you. All right, now let's go to the ones on Instagram, and let's feed you back here a little bit and find out all your wonderful questions. Let's go back a little bit. Pardon me for not waving back at you again. All right, first question. Is there a big risk if I don't get my RhoGAM shot at 28 weeks and just wait until after birth? So according to the medical establishment, that's when they recommend having RhoGAM at 28 weeks. In our practice, we give all of the information out about it, and I would say maybe 1 or 2 in almost 1,000 babies have opted to have their RhoGAM at 28 weeks. RhoGAM is considered good for 3 months, right? For 12 weeks. And so they didn't used to give it at 28 weeks. Now they give it at 28 weeks and then again after birth. So what you have to decide is if you have a blood test prior to you having RhoGAM and there's no antibodies built in your blood, and you haven't had an auto accident, a major fall, bleeding that would cause the potential of the baby's blood getting into your blood system and your blood system then building up antibodies, then it's something that you can research and read and decide, is that really something that you need, or is that just general protocol? If you had bleeding or had an accident or something that could potentially do that, then that could be given to you at any time within 72 hours of that incident, that your body would then try and not allow it to form antibodies. If you have the RhoGAM and then have the test, it's going to show up that you're sensitized, because it's there to make sure that you're not. And it's a weird thing in the test to be able to do that, but that's how it shows up. So in our practice, if women choose to have RhoGAM, which most of them do after birth, then we give it to them after birth, barring that the baby is also an Rh positive, which not all of them are. And so if they're Rh negative, they don't get RhoGAM. All right. Can you utilize the dandelions in your yard, create your own tea? You know, I've thought about that myself. And I guess on the one hand you could. I've had some grow out in my boxes out here, and they just get really big and full. And I think to myself, all right, is there any sprays that are going on around my yard? And that's the one thing in your grass that you'd want to be careful of. Is there any sprays or mowing the lawn and there's residual or anything like that versus something that's grown in a grow box that you know is being grown for food. So I'm not sure I'm comfortable with utilizing dandelion that's been growing in my grass. I'm not sure that there hasn't been any number of things that are going on with it. So I'm not comfortable with it. You'd have to decide depending on where you live and what those circumstances were. Maybe you don't mow. But I'm not sure I would feel comfortable with it. But in a grow box, yeah. And boy, do they grow easy. They are such little weeds of wonderfulness. You could go and research Susan Weed, S-U-N, Susan Weed, W-E-E-D, and see what she had to say about that. She's a great herbologist, especially on pregnancy. Can you utilize the dandelions in your... Oh, I did that one for you, T. How does a midwife indicate placenta previa without an ultrasound? Excellent question. So if a family chooses, which most of our families don't choose to get ultrasounds, some of them go for the entertainment ultrasound, you know, the ones that you just get your pictures. And sometimes the picture you can tell sort of where the placenta is. But what we do is we say if you don't want to have ultrasounds, we're fine with that. If bleeding were to show up, which it's usually mild, but it usually shows up closer to about 33 to 35 weeks as things start to soften and that lower segment starts to thin a little bit from the pressure of the what would be the baby, but is now the placenta and the baby. We go, you're having some bleeding. Why is that? And why isn't the baby engaging in your pelvis? Is there something in the way? And so then we say, well, now it seems like it might be a good time to go and let's check and make sure that there's not something in the way for this. Now, if there's a complete previa there, all care changes, right? Care has to be done by the physician and a cesarean would have to be planned. But that doesn't mean that they can't have concurrent care with us, because our role then is a great support, making sure that breastfeeding's doing well, and going back and doing all the postpartum visits like we would normally do. Because we feel like as our midwifery practice, just because something goes outside and they now need that extra care, it doesn't mean that midwifery care ends. Because there's a lot that we still do to take care of our families and make sure that everything goes well, even when there are some problems or conditions that come up. The other way is sometimes you can hear that placenta, but it tends to tell you about itself when something starts opening a little bit down there, that the bleeding starts happening, and then you go and you check it out. All right, thank you. We are struggling with conceiving our second child. First loss was ectopic. Then we had 2 miscarriages in 10 months of one another. I am so sorry. That is a lot to deal with. Any suggestions? All right. First, anybody who has had an IUD, which I don't know if you've had that, but anybody who's had an IUD, please make sure that you do everything you can not to conceive the first month after you have it out. IUDs sometimes can cause some difference in how the lining is working, especially if there's been hormones going in there. Give yourself at least 1 to 3 good cycles to get everything back to normal going on in your uterus. There is a theoretical risk with IUDs that they can cause some scarring, and some people can have some scarring that can create ectopics. That is something that we know with IUDs. Okay, so I'll just say that. Having an ectopic, sometimes it's like if there's a tube that's thinner or it's kind of kinked and something's occurred. It depends on whether you lost that tube and now you're conceiving out of the other tube. But there's also, I look at going back to that methylfolate. The MTHFR gene, which is why I talk about that methylfolate, is a gene mutation. And one of the things that can be very common in it is it can be that things don't subdivide right because folate and folic acid work differently in their bodies. So sometimes when the egg is dividing, the egg doesn't divide cleanly and something will not be quite right as the egg is being fertilized and the division happens and the body goes, oh, this isn't going to work right, and so there's a miscarriage because of it. So methylfolate, 800 to 1,000 micrograms, unless you're seeing like a naturopath and somebody tells you to take more because they know your history more, helps to make sure that those things subdivide in the ovary, and that once the egg is fertilized, that division begins to happen as best as it can, right? As best as every opportunity should. The other thing is that there's more risk of clotting. And many times women, birth givers, will have some spotting or some bleeding in those early weeks, and they'll get what's called a sub or a beneath chorionic, which is the outer of the amniotic sac. You have an inner one that's the amniotic sac and another sac around that that's called a chorion. A subchorionic hematoma, or a blood clot. And it means that there's been a vessel somewhere in there that's gotten a blood clot between those two on the placenta, and sometimes it can be big enough that the placenta can't hold on and it then can't continue to function and a miscarriage happens. So we recommend progesterone, which is wanting to make sure that the pregnancy hormone of progesterone, so that the body holds it. That's another reason that women miscarry. And so you could have your levels checked once you're pregnant, before or once you're pregnant, is to make sure that those levels are appropriate, so that if you need, we recommend using the cream, the Progestes, over the counter, and using double the recommended amount per day, and also a baby aspirin. And that's used both medical and midwifery, because of the fact that what it does is it stops that abnormal blood clotting that can happen in some women that can cause miscarriages. It also inhibits prostaglandins, so it causes the body not to want to let go of the baby, barring that the baby's still thriving, okay, and the baby's good. So those are two things that we recommend to families that have had repeated miscarriages, to make sure that everything subdivides with the methylfolate, that the baby aspirin and the progesterone are there to support and inhibit some things that could be going on in the body. And they stay on the progesterone for 16 to 20 weeks. They stay on the baby aspirin about that long, although sometimes they can stay on it longer. Sometimes they stay on it till even the beginning of the 3rd trimester, depending on what their circumstances have been. I like to say that if there's nutritional deficiencies, store up on lots of good green powders. Make sure that you're getting lots of wonderful green foods and lots of proteins to make sure that you have lots of building blocks in there. Past that, there is sometimes other dynamics going on between you and where the sperm come together. There can be lots of dynamics that only a fertility clinic can find out for you. But those are things that I know, okay? And sometimes it's not getting pregnant, it's holding the pregnancy that you're struggling with. And I know that those can be factors, so hopefully those help a little bit for you. All right, let's see here. We're gonna have to quit here pretty soon. Yep, we'll go about 5 more minutes. Let's see if I can get your other questions answered. What kind of pain relief is available for a home birth? I've always had an epidural and don't want them anymore, but I'm not ready to feel the pain for as long as I do. Okay, so in home birth, we have tubs, water tubs, right? Showers, massage. You can use, there are some people that use TENS units, which is little patches that do little pulses that cause the muscles to relax and tire. Kind of confuses the nervous system a little bit so that it doesn't react. What we find at home versus, let's say, in a hospital setting is that the being at home, being with the calmness, being with the quiet, and not dealing with questions and a lot of outside things and going to some place and lights coming on and questions and various things and getting into gowns and all of that, we find that they do better. The labors have a nice rhythm to them. And when they need to, they change positions and they eat, because when you don't eat and you don't drink, it's hard for you to manage a lot of that, okay? We know that when you get into warm water, it calms the nervous system. So you get in, you get out, you work with that, you keep nibbling and drinking, and you have that support, and maybe you have a good massage therapist there with you. There are what's called sterile water papules for people who get a lot of back problems. I have never done them before. That's not something I've integrated, not something I've needed, but that is something that some midwives do integrate. But no, there are no medications at home. But I find that when there's not all that outside stuff going on, you're not in a conflict of interest that stimulates the adrenaline that can sometimes make you feel more discomfort. Here's another thing. Some birth centers, many birth centers, are now carrying nitrous oxide. Some hospitals are carrying nitrous oxide. Sometimes that's an alternative to the epidural. At home, no, that's not an option because the machines and the equipment is too big to carry into home. I don't know, they may make it compact someday. Again, I've not seen a good use for it. If you have the MTHFR gene, and I know I come back to that, but I've had to deal with that enough with families, you feel sensations more exquisitely than someone else might. And if that is part of your story, then using warm water is one of the best tools that you have, because if you get cold, it creates more sensation in that way. And what I have used on families is a supplement called SAM-E, SAM-E, and I have them take 400 milligrams. And they start that in their third trimester, and they use it up through early nursing, sometimes longer, because it helps the chemical reactions in the body to be able to produce more chemicals, because there's not as many receptors in their body to handle the chemicals that will help them deal with adaptation to what's going on in their environment. I hope that makes some sense. But it's mostly water. Some people call them aqua doulas. I don't, but some people do. All right, let's see if we're getting to the end here. Your thoughts on the glucose drink testing and any alternatives to it. Okay, so there are alternatives to drinking the standard glucose. I have heard recently that there's a natural glucose you can drink. However, I have rarely, if ever, ordered an actual GTT test, where you go and you drink the glucose and you have the blood test taken. What we do is we look at your risk factors. If your risk factors are that you have immediate family who has insulin or medicated diabetes, then we might suggest that you do some home testing. I like them buying a glucometer, which you can buy online or at any drugstore, and that they take their blood sugars for a week. They do a fasting 1 hour after their main meals 3 times a day and record their blood sugars and what they eat and their activity. If those all look good, then things are well. We can do a random one in our office by saying, all right, I want you for breakfast that day, I want you to eat pancakes with syrup, and I want you to have a big glass of juice and some eggs. And then they come within an hour of that, we check their blood sugar. If their blood sugar is within reasonable levels, which means under 140 to 135, then that's considered our way of testing their blood sugar. If they've had large babies in the past, I do have them watch their blood sugar a bit. We put them on supplements. We do alter their diet to make sure that they don't increase another pound on those babies, because it's just too hard on the babies and it's too hard on the moms and the births, and we don't want a baby that has any difficulties with that. So doing home monitoring, but look at your risk factors. Do you have any risk factors for it? One of the risk factors in pregnancy is a baby who's getting large for dates or too much water. But one of the more simpler ones is yeast infections that won't go away, colds that won't go away. You feel tired and sick and you just don't feel good and something's not right. The blood sugar may be the problem. And so it's a good time to test it. And generally what I have found is when women test it and they start altering their diet, they start feeling better and they recognize it very quickly that that was the cause. Okay, let's see where we're at. Never had an IUD, so strange, right? Yep. What are your recommendations for pregnancy planning and protection? Not sure what you mean by that, Megan. Let's see. Where are we going? What would you ever accept a client that has type 1, right? And has had a C-section and a VBAC. The VBAC, yes. The diabetes gets tricky. That's one thing I will tell you about it, because if you're on any medication, that one we just can't do. All right, I have loved. Let's see. Let me make sure I've gotten everybody. Hey, Ari. Thank you so much, everybody. Wow, what a great night. It's so much fun to answer your questions, and I'm just telling you what we do, what I know. I am not the end all. Please do your research. Please apply it to your own individual circumstances. Okay, last one. Recommendations for family planning, avoiding getting pregnant when you're not ready. Yes. With that, I love natural family planning, but if you're nursing and you're not used to that, that doesn't work real well. Natural family planning is a great way to avoid any hormonal issues. It also puts both partners on track so that you're not saying, no, not tonight, I might get pregnant. Oh, well, how was I supposed to know? So you end up with your calendars, and many times I have the partner knows better when the fertility is and isn't than the woman herself sometimes. So definitely that. Condoms are the favorite choice that I give out to families because I'm not fond of hormonal birth control. IUDs are an option if a family chooses they want to use it. I suggest they don't use the hormonal ones because hormones are just not good for your body. It's really hard for your body to metabolize all of that. There's more risk factors for later in life. And you know, if you're going to be in childbearing years, you have to be able to take full responsibility of finding ways to be able to enjoy one another and also to prevent the pregnancy. But that's the simplest way. Is a condom works every time you use it. I know some of you may not have felt like that worked, but it's supposed to. All right. You are very welcome. So thank you so much for joining me tonight. You're all wonderful, amazing. I just cannot tell you how much each week I look forward to the fact that maybe something I've said is going to help someone have a pregnancy or a birth or something that is going to make your life better. Because I hope that I can take everything that I've learned and give that to you, and that it's going to make a difference in your life. Thank you for all the little hearts and the little bubbles. They're very rewarding. So go in, hug your children, tell them you love them, tell them how amazing they are, and that they can do anything that they set their mind to. All right, until next week, have an amazing week, and I'll see you then. Bye for now.